how do you use the AMH test to plan overall fertility treatment?
Yes, so looking at you can get the same destination, which is getting baby, from the different directions. Yeah, destination is the same. You want to have a baby, so you can have you can approach from various ways. You can have a shortcut. You can have a longer way to get to the baby. So, and there are different routes to the same success. So when, as a fertility specialist, when we see couples, we try to find the most optimal route to the success. Yes, we know very likely we'll get success. In most couples who come for fertility treatment, most couples will get success. But what is the most optimal route to the success, which is least stressful, fastest, least costly? So, and we formulate together with the couple, we discuss and formulate, say, look, this is the best route for you to success. This intervention, yes, or this treatment. So in patients, in women with a low egg reserve, if the AMH is so low, they have to get to the destination quickly, because they have to use the time as a most critical resource. Because as AMH goes down, which is egg reserve goes down, it becomes harder and harder to achieve successful pregnancy, even with IVF. Because quantity of eggs you get in IVF is by far quality, and the quantity of eggs you get in IVF by far is the biggest factor which determines your success in IVF. So, and if your egg reserve drops, that you start getting less and less eggs, it becomes harder and harder. So in patients with a low egg reserve, we ask them to use most effective intervention, which is IVF. And also in IVF, you can take a different strategies. Let us say I have a patient with a low AMH, very low AMH, and then they have a uterine problem. Let us say multiple uterine fibroids. So the one approach for this patient is let us say you need to solve the uterine fibroid, because it's so many fibroids distorting the cavity. Likelihood of successful implantation is very low. So you say, look, we got like window, we need to get embryos, get the eggs out and create embryos and freeze the embryos. You freeze multiple high-grade embryos. So next, maybe, I don't know, 3, 4, 5 cycles of IVF, depending on how easily they can create the high-grade embryos. Then you sort out the fibroid. Because when you treat the fibroid, of course, you have a waiting list for the surgery. It's major surgery. Then, and a lot of fibroid surgeries, you cannot conceive whole year. So then you got the eggs out and embryos out. You know, these embryos, depending on how many high grades you get, gives this couple at least maybe 90%, 95% chance. So while they are waiting for the fibroid surgery, they do embryo banking, then sort out fibroid, then wait another year until this uterus healed, then transfer, knowing that decline of the AMH egg reserve, let us say egg reserve, doesn't affect their future chance. So there's different strategies you can take, but AMH helps us to plan treatment. Of course, if AMH is very high because of PCOS, yes, we plan to do ovulation induction using Clomid or Letrozole or FSH. So that also helps us to plan fertility treatment. So that is a very highly individualized. It's not possible to write on textbooks or guidelines or protocols. It's impossible, because each couple's fertility is unique. It's like fingerprint. There are no two couples in the world have the same fertility, and this is why each couples in treatment or advice we give to each couple is individualized. So one of the tools we use to individualize advice is AMH and antral follicle count.